What is the mechanism behind the cystic fibrosis sweat test? Imagine a simple test that can reveal a hidden problem deep inside your body's sweat glands. That's exactly what the cystic fibrosis sweat test does. It measures how much salt is in your sweat, specifically chloride ions. In people with cystic fibrosis, these chloride levels are much higher than normal, and this difference helps doctors diagnose the condition. But how does this work? Let's break it down. Cystic fibrosis is caused by changes in a gene called the CFTR gene. This gene makes a protein that acts like a gate or channel on the surface of cells lining your organs. This gate controls the movement of chloride ions, which are tiny particles that carry a charge. These chloride ions are important because they help regulate the balance of salt and water inside and outside cells. When the CFTR protein works properly, chloride ions move in and out of cells smoothly, helping keep mucus and other secretions at the right consistency. In people with cystic fibrosis, mutations in the CFTR gene cause the protein to malfunction or not be made at all. This means chloride ions cannot pass through the cell membrane as they should. In sweat glands, this defect causes chloride to stay in the sweat instead of being reabsorbed. Normally, as sweat travels through the sweat duct, chloride and sodium ions are reabsorbed back into the body, making the sweat less salty. But in cystic fibrosis, because the chloride channel is broken, chloride ions stay in the sweat, making it saltier. The sweat test starts with a small electrical current called ontophoresis. This current helps push a medication called pilocarpine through the skin. Pilocarpine stimulates the sweat glands to produce sweat. The process is painless and takes about 30 minutes. After enough sweat is produced, it is collected on special materials like filter paper or gauze. The collected sweat is then sent to a lab where scientists measure the chloride concentration. If the chloride level in the sweat is below 30 millimoles per liter, it's usually considered normal. If it's between 30 and 59 millimoles per liter, the result is intermediate and may need further testing. When the chloride level reaches 60 millimoles per liter or higher, it strongly suggests cystic fibrosis. This high salt content confirms that the chloride channels are not functioning properly because of the CFTR mutation. This test is very important because it directly measures the functional impact of the CFTR defect on salt transport in sweat glands. It is considered the gold standard for diagnosing cystic fibrosis. It can be used in newborns, usually from about 2 days after birth, or in older children and adults when symptoms or screening results point to cystic fibrosis. In summary, the cystic fibrosis sweat test works by detecting the elevated chloride levels in sweat caused by the faulty CFTR protein. This defect prevents chloride from being reabsorbed in sweat glands, leading to saltier sweat. This simple yet powerful test helps doctors identify cystic fibrosis accurately and early, allowing for better management of the disease. Remember, if you or someone you know has symptoms or concerns, always consult a healthcare professional for personalized advice and testing.